Tired of looking exhausted no matter how much sleep you get? Those stubborn under-eye bags might be to blame, but don't worry, they're not always permanent. In this video, we'll break down the real causes of puffy, dark under-eyes and the best treatments, from quick fixes to long-term solutions. Whether it's genetics, lack of sleep, or fluid retention, we've got you covered. Let's get those eyes looking bright and refreshed. What are bags under the eyes? Bags under the eyes are those puffy, swollen areas that sometimes show up beneath your eyes, especially in the morning. They're a common part of getting older. As we age, the skin and muscles around our eyes naturally get weaker. This allows fat that normally supports the eyes to shift downward into the lower eyelid, which creates that baggy look. Sometimes, extra fluid also gathers there, making the swelling worse. Good news. Under-eye bags are usually harmless and more of a cosmetic issue than a health problem. Home remedies like cold compresses, placing a cool, damp cloth on your eyes, can help reduce puffiness. But if the swelling really bothers you, a minor eyelid surgery called blepharoplasty might be an option to consider. What causes bags under the eyes? The main reason bags form under your eyes is that the supporting muscles and tissues become weaker with time. This causes the skin to sag a bit, and the fat that usually cushions your eye can move into the area beneath the eyes. Plus, the space below your eyes can hold extra fluid, which makes things look puffier. Here are some common factors that can make under-eye bags worse or happen sooner. Getting older, as we age, everything naturally loosens up a bit. Fluid retention. For example, after you wake up or eat a salty meal, your body may hold on to extra water. Not enough sleep. When you're tired, your eyes can look more swollen. Allergies. Sneezing and rubbing your eyes can cause puffiness. Smoking. It can weaken your skin and cause swelling. Family traits. Sometimes, under-eye bags run in families. Certain health issues. Conditions like skin inflammation, dermatitis, muscle inflammation, dermatomyositis, kidney problems, or thyroid-related eye disease can cause swelling under the eyes. How to get rid of bags under your eyes. There are several ways to reduce the puffiness under your eyes, and the best method often depends on what's causing it. If your under-eye bags come from fluid building up in the area, simple home treatments can help shrink the swelling temporarily. But as Dr. Desai points out, home remedies and over-the-counter products can only do so much. For bags that are always there and more noticeable, medical treatments are usually needed to really get rid of them. At-home tips for puffy eyes. If you wake up with puffy eyes now and then, these quick and easy tricks might help reduce the swelling until it goes away naturally during the day. Cold compresses. Putting something cold on your closed eyes helps reduce swelling by slowing down blood flow in that area. You may be able to find relief from dark circles with a cold compress. Applying cold to the area can help the blood vessels constrict quickly for some temporary relief. Although you can purchase a cold compress at the store, do-it-yourself methods can work just as well. Some DIY options include chilled teaspoon, cool cucumber, wet washcloth, bag of frozen veggies. Before applying, wrap your compress with a soft cloth to protect your skin from getting too cold. You only need to apply the compress for a few minutes to see results. Hemorrhoid creams. Some people use creams made for hemorrhoid treatment under their eyes because these creams often contain ingredients like phenylephrine, which narrows blood vessels and reduces swelling. However, be very careful when using these around your eyes. They can irritate the sensitive skin and should never get into your eyes. Caffeine. Caffeine tightens blood vessels, which can help reduce puffiness. Many eye creams contain caffeine for this reason. You can also try resting cooled tea bags from caffeinated black tea on your eyes for a few minutes to get a similar effect. Add retinol cream to your routine. You may have used eye creams in the past, but concentrating on specific ingredients is key. Retinol creams have been used for a variety of skin issues, including acne, psoriasis, aging. This ingredient is related to vitamin A, and it comes in cream, gel, or liquid form. When applied to the skin, retinol can improve collagen deficiency. Concentrations of retinol may vary among different OTC products, but stronger creams require a prescription from a dermatologist. Certain retinol products shouldn't be applied under the eyes. When choosing a product, look for something intended for use under the eyes. Experts typically recommend applying retinol to the skin once daily, about a half hour after washing your face. If you're pregnant or nursing, doctors usually recommend avoiding retinol creams and extra vitamin A. Non-surgical treatments. These options don't involve surgery and can smooth out the under-eye area. Fillers. This treatment involves injecting a gel-like substance called hyaluronic acid under the eyes, usually where the lower eyelid meets the cheek. It helps create a smooth, natural-looking transition and reduces the appearance of bags. The procedure is done in a doctor's office with a local anesthetic, and the results typically last between 6 months to a year. Laser resurfacing. Using a special laser, this treatment removes the top layers of wrinkled skin and encourages your skin to produce new collagen. Collagen is what keeps skin firm and youthful. Depending on your skin type and how much sun you get, the results can last for years. Chemical peels. A chemical peel uses a solution to gently dissolve the outer layers of old skin, revealing tighter, brighter skin underneath. Like laser resurfacing, the results depend on your skin and sun exposure, but can last a few years. Surgical treatment. Lower eyelid lift, blepharoplasty. This is a minor surgery where the doctor adjusts the fat under your eyes and tightens the muscles and skin to create a smooth, refreshed look. It's usually done as an outpatient procedure, meaning you go home the same day. This surgery often permanently removes under-eye bags, and most people don't need any more treatments later on. Sometimes, patients may benefit from a combination of treatments, like using fillers along with laser resurfacing or surgery, to get the best results. As Dr. Desai says, multiple approaches can work together to effectively treat under-eye bags. Tips to help prevent bags under your eyes. Sleep with your head elevated. Try using extra pillows to keep your head raised while you sleep. 2 or more pillows, or a wedge-shaped pillow, usually work well. Elevating your head helps stop fluid from settling under your eyes, which reduces puffiness in the morning. If propping up your head feels uncomfortable for your neck or makes it hard to fall asleep, another option is to raise the top end of your bed by a few inches. You can do this safely using bed risers or placing bricks under the bed legs. Aim for at least 8 hours of sleep. While not getting enough sleep might not directly cause bags, it can make your skin look paler. This paleness makes any dark circles or shadows under your eyes more noticeable. Experts recommend most adults try to get between 7 and 8 hours of sleep every night. If you struggle to get good rest, here are some tips to improve your sleep habits. Set a regular bedtime and wake-up time, even on weekends. Avoid nicotine in the hours before bed. Skip caffeine for at least 8 hours before bedtime. Don't drink alcohol close to bedtime since it can lower sleep quality. Avoid heavy meals right before bed. Finish intense exercise a few hours before you go to sleep. Turn off screens, like phones and TVs, at least an hour before bedtime. Try relaxing activities before bed, like a warm bath or deep breathing. Keep your bedroom cool and dark if possible. Eat more collagen-boosting foods. As you age, the muscles and tissues supporting your eyelids get weaker, causing the skin to sag and fat to shift. Vitamin C helps your body absorb hyaluronic acid, a natural substance that keeps your skin healthy but decreases as you get older. Eating foods rich in vitamin C and amino acids supports collagen production and healthier skin overall. Good vitamin C sources include oranges, red peppers, kale, Brussels sprouts, broccoli, Strawberries. Include iron-rich foods in your diet. Iron deficiency can cause dark circles and pale skin because your body isn't getting enough oxygen to your tissues. Other signs of iron deficiency may include feeling very tired, cold hands and feet, or brittle nails. A doctor can test for anemia and suggest ways to increase your iron if needed. Foods high in iron include red meat, pork, and poultry, seafood, beans, leafy greens like spinach and kale, dried fruits like raisins and apricots, iron-fortified cereals, breads, and pasta, peas. Reduce salt in your diet. Eating too much salt can cause your body to hold on to extra fluid, which can make your whole face, including under your eyes, look puffier. It can also raise your risk for other health problems like heart disease. The American Heart Association suggests limiting salt to 2,300 milligrams a day or less. Ideally, adults should aim for no more than 1,500 milligrams daily. To cut back, avoid packaged and processed foods, and focus on fresh fruits and vegetables where you can control the salt you add. Cut back on alcohol. Alcohol can dehydrate you, and dehydration often makes bags and dark circles worse. If you want a tasty alternative, try flavored sparkling water or add fruit slices to plain water for a refreshing twist. Quit smoking if you smoke. Smoking lowers your body's vitamin C levels, which are important for making healthy collagen that keeps your skin firm. Smoking can also make wrinkles, dark circles, and under-eye bags worse. Quitting smoking is great for your skin and overall health. It can add years to your life and reduce your risk of many diseases. Doctors can help you quit by recommending programs, medications, or other support to manage cravings and withdrawal. Under-eye bags don't have to be your forever struggle. Whether you try cold compresses, better sleep, skin care, or professional treatments, there's a solution for you. Remember, consistency is key, so pick the methods that fit your lifestyle and stick with them. Ready to say goodbye to tired-looking eyes? Start today and wake up to a brighter, more refreshed you. Don't forget to like, subscribe, and hit the bell for more expert beauty tips. See you in the next video.